watch.
We're live.
And we
Friday
are
night.
live. And we are live. We are live. We are live.
What are you drinking, sir? That looks very fancy.
It's a Mai Tai on the rocks.
Wow.
Yeah.
I'm jealous.
I get about down to here, and if I have any more, I wake up tomorrow morning and I'm just done. So I've reached the perfect point where if I can't have any more.
That's an old person thing. You know, do you remember back in the day when it was like there was no limit, there was no line on the glass, you know?
Right.
There was no counting drinks, right?
Back in the day, it was like,
yeah,
I'll have 2 of these.
Right.
You know, like there was absolutely no limit. Good evening, one and all. Hope you guys are having a great evening. And well, Glenn, why are we here? Should probably start off by telling the people that. Why are we here? What's the emergency?
Let's get into the emergency of the evening, you guys, which is and before we get started, if you have any questions surrounding AEP, we would love to answer them. Drop a comment below the video. We'll be reading comments as we're going. But really just wanted to get into AEP. There's not necessarily one specific thing AEP related that I wanted to jump into, just kind of talk about all of it as we're on the brink, the 1 yard line, if I may. And one of the first
mention it.
Yeah, are we going to give it to beast mode? Yeah, are we going to throw a pick here on the one? But one of the first things I wanted to get into that I saw posted today or yesterday, there was a post, and I believe the communication came actually from Integrity. If I'm going to be really specific here, yeah, I don't know if you're like and Elvis has left the building, you guys. The communication was talking about the inbound call rule. Oh, wow. That's why he left. Okay. So he's speaking for the company now. At first, I thought he was leaving because he did not want to answer the question, you guys. We actually have an Integrity representative here on the podcast today.
Not even a little bit.
The question was, does the inbound call rule apply specifically? I don't know if it was like around field agents specifically, or if it was just kind of more in general. And one of my favorite parts about the post, because it did seem to be copy and pasted communication based on the post I read. It seemed like this came straight from the source. It talked a lot about indirect communication or indirect conversations that weren't straight from CMS, which in my opinion is one of the main problems with compliance surrounding AEP or compliance year round, really, is when you have certain sources that will share something, but it's not necessarily direct from CMS. And then, I've seen some indirect posts that get shared all over, and it becomes gospel truth just because the people who shared the posts, you know, they have clout, and all of a sudden, okay, this is how the rules are to be interpreted. So,
or maybe they don't even have clout, but it's just something that people like how it sounds.
Sure,
it's a random person that nobody 100%. Knows, right? Like how
they
much
like
do that? Like I've seen a lot lately where people will comment some advice or like an answer to something in groups that's wrong. That's clearly wrong, and like 1 million people will like it that are also wrong. And they just don't know any better. They're like, that sounds good because they said that with conviction.
Right. 100%.
A lot of it.
I think we're all guilty of that to some degree. Cherry picking, you know, posts, comments that we like that fit our narrative. Mm-hmm. And that's in a perfect world, you guys, I honestly would love for CMS to have like just clear bullet point listed, everyone understands it, super simple rules, right? I can't stand the bureaucracy that surrounds this, where I mean it gets litigated to death by carriers, by large call centers, IMOs, FMOs, to the point where it's so convoluted. Half of these rules, I can't even tell you what the truth is. So um, I feel like I have to find this specific post. Now, hang on a second. But anyways, no. Did you see this? Have you heard anything about this? The inbound call rule potentially not applying, I guess, to field agents?
I've seen plenty of posts mentioning that. I haven't seen any that may have come from like Integrity or anything like that.
Let me see if I can find it so I can actually like read the verbiage, because it seemed very specific.
I'd love to know, like, was it like a public statement by Integrity? I mean, I would imagine I would have received this statement, like, instead of the Facebook groups.
That's right. That's what
I would hope. I would hope.
I would think so too. Being that you're a spokesman for the company now.
Absolutely not a spokesman.
While I'm looking for this, what on your end with AEP, what's going on? I'm going to try to find this post, you guys.
Let's talk about this, guys. Let's have a conversation. So we are literally a few days away from the first, right? Like the day after tomorrow, which isn't a great movie, in my opinion. Day after tomorrow is October 1st. Now, it's a Sunday. So for us, it really kicks off internally on Monday, which is the 2nd. And it's here, guys. We are here. And not only are we here, to me, I have said this multiple times, and I've gotten pushback from like people that are in like 3 markets that this isn't impacting, which but like nationwide, I believe that there's probably more changes happening just from plan changes, right? Like carriers making more changes, taking a step backwards, other carriers seizing the opportunity and taking a step forward, not even necessarily new plans coming in or plans pulling out or anything like that. But like, I am under the impression that this AEP is really going to be a bloodbath, my friends. Like, I am under the impression now, anytime there's a bloodbath, there's somebody that's going to take a bath and benefit from the carnage. And so it's just, to me, this is one of the most anticipated AEPs that I've had in a very long time. And I think there's a lot that's going to be happening. And I think, it's here. It's here, ladies and gentlemen. We have a lot to talk about tonight.
Okay, so I did find the post, and it says they write. So again, this seems to be a direct quote. It's not like a screenshot. I don't know the exact source, but it does appear to be a direct quote. They write, and it says, apparently this came from Integrity Marketing Group.
So, but they're just copy and pasting something. They don't have like a screenshot or anything.
Yeah. I don't know. Like I said, I don't have an exact source on where this communication came from.
Okay.
It is quoted to be from Integrity, and it does appear to be a direct quote. They write, the language used to describe the walk-in exception and CMS's regulation is for on-scheduled in-person meetings, walk-ins initiated by the beneficiary. CMS specifically uses the phrase in-person meetings. CMS also discusses this exception as being intended to assist those beneficiaries who have traveled in person, who have transportation issues, and have traveled long distances. However, this question has been the source of a lot of industry confusion. We are aware of informal communications. That was the term that I thought was great, because informal communications, that's what we're seeing a lot of, right? We are also aware of informal communications indicating that the walk-in exception may be interpreted to apply to unscheduled inbound web-based technology initiated by the beneficiary, such as web-based chat. We caution that informal communications from CMS to third party and informal communications from other sources are not law, regulation, or even published agency guidance. Some carriers have published agent guidance documents stating that the walk-in exception applies to unscheduled inbound calls initiated by a beneficiary. Downline agents and brokers that sell plans on behalf of carriers are typically contractually obligated to comply with contracted carrier guidelines as well as CMS rules. Accordingly, it may be reasonable for agents and brokers to follow published guidance from their contracted carriers that state the walk-in exception applies to unscheduled inbound calls initiated by beneficiaries. However, we caution that not all carriers have published guidance supporting this interpretation, so your contracted carriers may provide conflicting published agent guidance. We hope that CMS. I mean, and like, isn't that wild in and of itself, right there? Like, you have to. So they're saying, okay, you have to play by the carrier's rules and CMS's rules.
And those rules will contradict each other.
They will contradict each other, but you have to follow all the rules.
So because they contradict each other, if you follow party A's rules, you will then in turn break party B's rules.
Right.
That's what I hear when I hear something like that. And that does kind of reflect some communication that we've gotten. I didn't, and maybe there's more. I don't know if I cut you off.
One more sentence. We hope that CMS will provide some clarity regarding its interpretation of the walk-in exception in published sub-regulatory guidance soon. And again, I don't know exactly where this communication came from, how old it is, did this just happen, etc. It seems to be recent communication. But to be waiting for clarification on a rule like this
2 days before
it's Christmas Eve. Yeah, it's Christmas Eve, and we're not sure when Santa's coming. Like, I don't. It's honestly, so again, this kind of encapsulates everything for me. It really does. It's great. I think it's great. So it's not like a knock on integrity by any means, but it also is insanity, really.
To me, it's very honest. If that did truly come from integrity, I can't speak one way or the other, but if that did come from integrity, I view it as honesty, basically like admitting publicly what I've admitted publicly in the Facebook group. And that is, there is no humanly way possible to follow every rule of every carrier because they contradict each other. So like, if you have to tell someone that 2 + 2 is 4, and in the same breath with another rule, you have to tell someone 2 + 2 is 5, how can you follow the rule? Right. You're gonna break the rule in one way or the other. So to me, it's just being very like forward and honest. It's like, listen, this whole situation's fucked. Like, I mean,
yeah, I mean, honestly, but
legal terms, that's what I read. That's what I heard.
Right. But what do you do? What do you do as an agent?
Yeah. So I will be very careful with my words because, as Andrew Tate once said, I'm under investigation. No, I'm just kidding.
CMS has bugged my home.
Yes, they're listening to everything. I'm basically the mafia at this point. I'm John Gotti. So this is my message to agents, right? Because the rules are so convoluted and so all over the place, and there are so many contradictions, the main thing you have to focus on is doing the best job that you can, but not obsessing over it from the standpoint that it's going to prevent you from doing business and helping people. The main thing I would say to agents is if you need to make sure that your intentions are in the right place, right? That you are having a heart to serve these people and that you are trying to really put them in the best plan, that you you in your whole heart believe that it's the best plan for them, and you're trying to do a good job for them, and you're trying to follow the rules as best as you can. But I don't think it's anything that you're going to have any success by over analyzing and putting it under a microscope and trying to literally follow every single guidance and every single guideline, because it is frankly impossible when there is contradictions. If you represent 10 Medicare Advantage companies, which many agents do, and all of them have their own 10 different versions of interpretations of a certain rule, how on earth can you follow that rule in its one instance? There's one action that you're taking.
Right.
There's one.
Right.
And one action can't hit all 10 bases, because the answer to the question of what you're supposed to be doing is different. So you need to do the best job you can. Like, there's some things that are cut and dry, right? Like, get your scopes, get them 48 hours before, with a few exceptions, right? Make sure that you're, checking prescriptions, you're checking doctors, you're reading your disclaimers, all that stuff. But outside of those obvious ones, do the best you can and do a good job for the client. And, I've always been under the impression that when you get an allegation, the main thing I think they're looking for is, what was your intention with that appointment, right? Like, what was your intention with that client? Was your intention good or was it bad? And that usually has a lot to do with what ends up happening in your disciplinary actions. Were you disciplined truly, or are you just given a little bit of coaching and guidance, right? So that's what I would tell agents, is just try to do the best you can, try to, have a heart to serve. But there are certain things that are cut and dry that everybody agrees on, and make sure that you don't mess up in those rules, like your scopes, your 48 hours, your disclaimers, that kind of thing.
I think you also kind of have to defer to the carrier, in my opinion, too. You can't call CMS up and ask them a carrier question. Hey, what does Aetna want me to do for this? Here's
the problem with that, though, is if all the carriers are contradicting each other, you don't really know what you're going to sell going into an appointment. You know what I'm saying?
Right.
So, if Aetna has a rule that is, this, and Humana has a rule that's this on the same situation, and they're different, like, what do? You don't know what's going to be the best for the client. And so it puts in my opinion, it puts agents in a no-win situation. And I think the best thing you can do is just literally do your best.
Yeah. I mean, I like what you said. Don't allow it, even though it is convoluted, even though there's a chance that you might be playing by the rules 98%, but there's some sort of 2% window where it's a certain carrier that has different rules that you end up writing that application, etc. Again, we just went through that press release that talked about how convoluted some of this is, and we don't have exact answers from CMS on. Do your best. Take care of the Medicare beneficiary first and foremost. And if you're doing that, you really have very little to worry about.
Yes.
I also am a huge fan of recording everything. And when I say recording, that doesn't mean necessarily like literally recording, but actually there was this example back when I was just a wee lad in the industry, just a young agent,
a young pup,
a young little agent. And I remember I'm in a conference room.
No beard.
If there was a beard, it was very short. And there was an older lady there. It was an agent I'd never met before. And again, I got a little itch here, guys. Sorry. Got itchy ears. I was not selling Medicare or really in the Medicare space at all at the time. Uh-oh, he's passing the line, you guys. He's going to be worthless tomorrow. Thank goodness it's Saturday and it's not October yet. I was not in Medicare really at all. This was probably, way back, 2014, 2013. And she was, I felt like she was a very good Medicare agent just based on the conversation I was listening to. It seemed like she really knew her stuff. And she documented everything. if she talked to a client, even if it was kind of like a customer service call or like a one-off call, she's writing down the time that she had like a calendar or a journal. She was doing a lot of this manually by paper. But she would write down when the call happened, what was discussed on the phone call, why the phone call happened, and it saved her many times. If there was an allegation, if there was confusion, she was able to look back at her records and say, no, and obviously if it was a very serious allegation, you could probably even pull phone records to, corroborate your personal records, right? Like if you wrote something down and you had notes like that, a good CRM system today can help you with a lot of this stuff.
Mm-hmm.
Shout out to DFY Go High Level, Mr. Eric Fierro. You can record phone calls in there, schedule appointments, take notes on the client, etc. And I think that can really prove your intention in a lot of ways if you have all those notes.
Yeah, for sure. Like internally, that is how we protect ourselves at CBIS. Like every single thing that happens in CBIS is documented. So every single call is recorded and it goes into our CRM, inbound and outbound. And then in addition to that, we put notes of every single call in the CRM in addition to that. And that has saved us a couple of different times over the years, even if it's not an allegation situation. Maybe there's a client that calls in 6 months down the road and says, you told me this.
Right.
You told me, Glenn, that I would grow wings and fly if I signed up for this plan.
Only if you drank 2 Red Bulls back to back.
Yeah.
That's the only way that happens.
And right. Like, and you can go back and reference that phone call, reference the notes of the communication, and you can be like, no, that most certainly didn't happen, and I can prove it. And remember, I've said this many times on, I think, Taco Tuesdays and maybe Emergency Podcast. Emergency Podcast might need to be its own thing, you guys. It's kind of phenomenal.
We need an LLC, Emergency Podcast LLC, trademark it.
I'll get started on it tomorrow.
Right now.
But anyway, like, it's one of those things where those things can certainly, kind of save your butt by
100%.
having that documentation and kind of storing it in the CRMs. And you need to protect yourself. You can't trust anybody. I've said it before and I'll say it again. We're dealing with seniors that have a tendency to be forgetful, right?
Yep.
And so you need to keep that in mind and understand that anybody could surprise you and 6 months down the road make some crazy allegation that you said something when you didn't.
Tell me, with this AEP kicking off here in just a couple of days, what do you think is something that agents are sleeping on this year that you're not seeing a lot of communication about? Maybe it's something technology related. Maybe it's a certain carrier. Talk to me. What are you seeing? What are you thinking? What are these agents sleeping on right now at midnight on a Friday night?
So I have a couple of things, and it might not be the most popular answer here. The first one I have is...
I'm nervous. I'm nervous right now.
The first one I have is Ask Integrity. I used it the other day for the first time.
AI tool. Yeah.
I used it the other day for the first time. And guys, this tool is freaking gangster. Like it's very good. It's
we're back in the 90s.
But the tool is very helpful, and it's one of those things where if you have already put a lot of your data into Medicare Center, that it can be extremely useful and save you a bunch of time during AEP. So that's one thing that comes to mind when you ask the question. But I think in addition to that, I think I wouldn't say it categorizes itself as something that hasn't been talked about, because I think it's been talked about a lot. But I still think there's a lot of agents that are sleeping on the impact, and that is what's going on with the PDPs going into next year. Like there's been so much conversation about the PDPs, but there's still so many that are like, Medicare Advantage is bullshit, MedSup to the moon. I did an appointment with a new agent actually in Utah. I sat in on an appointment with her today, and I helped her a little bit with it too at our office. She's a new agent in Utah, and essentially what happened was we checked these prescriptions for this lady, and on Medicare.gov, somebody posted it earlier. You can see the 2024 plans now in Medicare.gov. You can see the drug comparison now, even before 10/1. So we take a look at this, and the best Medicare Advantage plan saved her about $1,500 a year in drug costs versus the best PDP. Like that's a pretty big number. This is a lady that doesn't qualify for Medicaid, but she's probably, a couple notches above qualifying. She's not doing extremely well financially. So that's a big number for her.
Sure. And that's a lot of money.
Like, I think there's just not enough conversation being had about what is happening with the PDPs, how so many PDPs are either raising the premiums up dramatically or they're changing their tier 3 and tier 4 copays to 20%.
They're not getting the drug savings like they used to.
Right. The cost is dramatically higher. And so, like, if you have a MedSup person, if they're paying the MedSup premium, let's call that $1,500, $2,000 a year more in premium, maybe more. Plus, they have to pay an extra $1,000 a year in prescription costs. It may be more for some cases. It's a big blow, in my opinion.
What about the government coming out recently and saying that they're going to start entering into these drug price conversations, essentially trying to really lock costs for seniors? Was kind of my interpretation. I want to say there was 10 specific drugs that got announced that they're going to be negotiating the prices with the pharmaceutical companies.
I think it'll have an impact, but I don't think it's something that we'll see 1/1. I think it's something that when I hear the term negotiation, I mean, what I think is they're going to have that negotiation over the course of the year.
Right.
And we might not see any impact on it until 2025, on that list of 10 drugs. And, this is something I think about too. Like, I had somebody push back on me when I said this in an interview a couple weeks ago, but I'm like, when I hear the term negotiation, it's something where it's like, well, can't they just say no if they don't like the terms? Right? Like, you're negotiating with them. So it's like, they have a lot of say in it if it's a negotiation, and it's not just a mandate. It's like, okay, you're going to do this. It's a negotiation.
It's a for-profit company, right? So like they're not going to operate at a loss unless the government wants to subsidize those costs, right? Which that wasn't how it read to me per se, right? Again, it read more like we're going to try to lock in prices, or get certain prices down on more popular drugs that the majority of seniors are taking. The insulin cost reduction, that was really popular. Mm-hmm. So it seems like they're trying to almost in some ways expand on that. I think it is going to be interesting. We're just going to see more and more drugs, right? I mean, the pharmaceutical industry is booming. There's just more and more money going into it. There's going to be more, chemicals essentially that are going to help seniors live longer, live healthier lives. It's just the biomedical science world that we live in today. So I think it probably is something that's being slept on in the sense that, I could see it potentially being bigger than doctors if it's not already, right? I mean, how many seniors are not necessarily going to see their doctor, but they're at home taking those drugs every single day?
Yeah, I think you could make the argument that today it's equally as important for most and more important for others.
Sure.
You know what I mean? Like, I think it's going to be one of those things that it's always been important, but I think it's at an all-time high in importance because of the inflated cost of so many prescriptions.
Sure.
Another thing I don't think people are thinking about as much is, and they should be paying attention, I will not say the name of the carrier to not incriminate myself, but there are carriers, guys, that are putting out 50 cent a month drug plans next year, $1 a month drug plans.
I saw
Never
that.
been done. Why do you think they're doing that? Like, think for a second. Ask yourself the question.
Purely for marketing. It's 100% to capture these people to be able to remarket to them. That would be my interpretation for sure. Yeah,
that is 100% it, right? And like this carrier in particular,
it's the dollar menu at McDonald's.
Yeah,
right. Like they don't want you to come in and buy the dollar menu, guys. You know, like they want you to get a soda and a Big Mac and ice cream. Like they want, you know.
But think about it like this too. It's not as simple as I think as them just marketing to the client. Like we can handle that, right? Like
right.
But what this carrier in particular has been notorious for doing, and anybody that's been in the space, any of you agents that are watching that have been doing this a long time, you might have seen this with your own clients. Is this carrier has been notorious for giving lists
a name
members.
Just got dropped in the comments.
This carrier has been notorious for giving lists of PDP members to agents in the area, independent agents, and having those agents go out and try to move them to Medicare Advantage plans. And it's a concerted effort of basically trying to churn, right? There's absolutely no loyalty for your business. And so they're looking at that as okay, this has worked pretty well for us the last couple of years. Let's do this as a massive scale. Let's even potentially take a loss on our PDP plans for a year in order to position ourselves to do this more effectively in 2025. And so that's something that I think is happening and rolling out right before our eyes right now that there's very, very few people talking about.
I've seen one conversation publicly about that, and it should be concerning from an agency owner or an agent perspective when you're talking about retention, which is a huge conversation over the past couple of years. You know, previously in the Medicare world, retention wasn't even really talked about because you sold them a policy and you're going to retain 90% of your clients without really having to do anything.
Mm-hmm.
But that the game has changed, and this type of business practices is part of the reason why retention has become such an issue. You know, hey, Mrs. Jones, you got to get on this 50 cent per month PDP. It's a no-brainer. You're going to save money. You're not on any drugs right now anyways, right? Blah, 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 whatever it is. But then they're going to turn around and that PDP that was 50 cents, they're actually going to try to move your client in OEP, and you're going to lose that renewal. So yeah, I think that's a really big one. Another one I'll mention too, you guys, without necessarily getting into specifics, I kind of see a future, and Christian and I have gotten in trouble before for what I'm trying to remember what the term was that they labeled us, and I was like, that's exactly what we do. So we speculate. I guess
I know exactly what you mean. I know.
Yeah, you remember what I'm talking about, don't you?
It was the CMS final rule
earlier
this year because we were speculating when everybody was speculating.
Right.
Unless you're in the meetings with CMS, you're speculating.
It's like Fox News saying this is just for entertainment, guys. Like this is just for entertainment.
Tucker Carlson is speculating about Michelle Obama and Barack Obama.
Oh man, late night Friday night, guys. You're here. You're witnessing it live. So I'm gonna speculate based on what I'm seeing now, what the direction I think things are going. I see a future where the Medicare part of the conversation it'll only become a piece of the services or the policies that you're offering. We're already kind of seeing the expansion now. I see a future where you're going to go in there and the Medicare policy is kind of already a piece of it. It's already done. It's there. But the conversation might be about XYZ beyond just that Medicare policy. And some examples of things today that kind of fit this, hospital indemnity plans, dental vision hearing plans, cancer plans, home health care plans, right? There's all these different plans that could kind of plug into the other spaces, essentially the other needs that a senior has, that it's still healthcare related, still falls into that niche. A comparison would be if you look at like some of the big cell phone carriers. It used to be, it was just a cell phone when you walked in there, but now you go in there and the cell phone plan is almost kind of a guarantee, but they're going to talk to you about all these other things. Do you need a tablet? Do you need home internet? Do you need some accessories like a new case for your phone, etc.? I kind of see the future seems to be going that direction. What do you think about that?
I could definitely see it. And I think it makes a lot of sense. It's one of those things where it's definitely scary to think about. It's frightening.
Maybe it's a good thing.
Maybe
it's a further monetization of the healthcare world, and maybe there's more money that gets passed along to agents. I don't know.
It could be
speculation.
Speculation. Glenn's speculating on a Friday night.
Late night Friday night speculation, you guys.
So it's interesting. One thing that comes to mind for me in this conversation is our pizza here? Oh, I want some pizza.
I love that, man. That's great.
What type of pizza? Can we get the pizza guy on live?
There's
Domino's.
There's a
You're fine. Have a good night.
Papa John's. I need the name of the pizza there.
Who was that?
It was a pizza guy. He was excited to deliver.
He was excited to talk to you?
The pizza guy making a late night live.
That's very strange. That's very weird to happen on live.
Can I get the is it a local
you need
pizza?
To leave the pizza to me. Who is the pizza from?
Domino's.
I called it, guys. Domino's.
Okay.
Guys, this late night podcast is sponsored by Domino's. Get your pizza delivered in 30 minutes or less. Otherwise, it's free.
So it makes me think about, though, this previous conversation we were having. It makes me think about something that Galen Hendricks told me years ago. And that was, This was probably 2 or 3 years ago. She told me this privately, but I'm sure she wouldn't mind me sharing it. At least I hope not. Love you, Mama Galen.
Private Galen Hendricks conversations coming out late Friday night. I love this.
But she told me basically like the way that the med sup market was going at that point in time, if agents didn't bundle and cross sell more, like dental vision hearing policies, home healthcare policies, cancer policies, that the carriers couldn't remain profitable in a lot of instances. Like the carriers were depending on those ancillary sales to be able to not, just take it in the shorts on the med sup products. And so it makes me kind of think about that a little bit, because in my opinion, I think the majority of agents, and I'd love to hear your thoughts on this, but I think the majority of agents don't take advantage of cross-selling as much as they should or could, right? Like they leave money on the table. I think it's actually probably the minority of agents that really cross-sell like they could. And so
I think it's less than 10%. If anybody feels like they have a stat that is, out there published, more reliable than that, I've always felt like out of 10 agents, maybe one cross sells on a consistent basis. I'll give you guys an example. There's a relatively large agency that at Lead Heroes we do quite a bit of business with, and we've tried with this agency so many times, especially during this weird period between like September, like right before AEP starts, where, you know, maybe you want to chase something other than Medicare Advantage, right? Because you don't want to sell last year's plans. The new plans are about to drop, right? So it's like, what do you do in September? So there's this relatively large agency that we market for, that we've been marketing with for years, and we've tried to do ancillary products during this month so many different ways. You know, dental vision, hearing. I think we did maybe some home health care. I don't know if we ever did cancer, but sorry guys, I don't know why the pizza guy was so excited.
That is my wife. That is my wife that commented.
He was very excited.
He was stoked.
I honestly thought it was a family. I thought a family friend was rolling in. I was like,
I'm like, wow. Is this like an ex-boyfriend right here? No, like that I don't know about, the pizza guy. You know, I think I'd come out ahead in that circumstance, but
you might make a little more money than a pizza delivery guy. I don't know. Maybe a tiny bit. Man. Completely derailed. Oh, the ancillary. Yeah. So when it comes to marketing Medicare, the agents for this agency have been really consistent. Like, we're able to see the numbers, like they're selling. Anytime we seem to try to pivot to an ancillary product, the consistency just goes out the window. The sales just aren't there. You and I have kind of talked about, again, previously, Talk About Tuesday, other lives we've done, podcasts, etc. Talked about how a lot of agents struggle to sell. That a lot of agents are addicted to the zero premium policy.
Order taking.
Yeah, order taking.
I think if you're an agent and you've never had to collect a routing and account number, you don't really know how to sell.
Oh, my gosh. I can't imagine.
Never.
The voided check, Mrs. Jones. Yeah. So I just need you to get a check. Just write void across it. Means it's no longer, a real check. I just need it. So that way the insurance carrier can draft those premiums. It can be a hard conversation to have, but
do you want that to come out on the 1st or the 15th?
Yeah.
Or like
you do get to pick. Yeah, you do get to pick what day that comes out.
And I mean, if you've never had to deal with someone not knowing their account number, which seems like half of people you talk to don't know their account number. And then
100%. So I think that could be part of the reason why we don't see ancillary sales like we do, because it does require some level of salesmanship, right? There's no zero premium ancillary products that I'm aware of, right? You have to pay
zero premium dental vision here.
Yeah, zero premium dental, baby. There was a question in the comments. There's
a few.
The one that I saw that that I thought was a great question. Appreciate the person who asked it. I can't see who it is from StreamYard, but how do you protect yourself with in-person appointments when you're obviously not recording the call? You wear a wire? Like you have to wear a wire
tape recorder with you.
You have to have it hidden. You don't want them to see it. And you're
okay. So
safe.
Here's what I'd tell you, right? The chance of, man, I really want to say this on live? I don't know. I'm just going to say it. So assuming that you are doing what we talked about earlier and, doing everything the right way,
right.
Doing your best, putting the client first, yada, yada, yada. If it's not recorded, the best thing you can do is take notes of the situation. And there is a 9 times out of 10 chance that that's going to go unfounded because there's no recording that they can listen to. And there's no way they can prove that you told them what they're insinuating that you told them, right? So that there's a very high chance that the appointment will go unfounded. The allegation will go unfounded.
That's not an unreasonable thing to say by any means, you know. I don't think it's not like you're encouraging that type of behavior. It's just that's the reality of it, right? If it becomes like your word versus their word,
there's no way to prove it. Yeah, there's no way to prove it. Like,
if it's not something blatant, like you clean sheeted an app or something, right?
Right. Like if you're doing something nefarious, and a call recording is actually your worst enemy if you're doing something nefarious.
Yeah, absolutely.
And so but if you're doing everything the right way, and it ends up being your word against theirs, it's going to most likely come back unfounded unless there's just some severe evidence that there was something bad done, like that's not my signature, for example, and we can get off into the weeds into that, but we don't need to.
Yeah, I think, you don't necessarily go into the appointment thinking, how do I protect myself when I'm presenting, options to the senior, right? Like you shouldn't be looking at it that way. But the flip side is you should have enough information that if a carrier or, CMS were to ask for more information, which that's how complaints, that's what happens. They want more information. You should be able to tell them what happened. And it should be pretty clear. I saw this person at this location at this time on this day. This was the initial marketing. This is what generated that appointment. Here's the scope, etc. Like whatever information you have, you should be able to present it. I think I don't know. Again, it kind of goes back to don't overthink it. Don't paralyze yourself with fear to the point that it's affecting your sales. That you're not writing business. Yeah. What other questions did you see?
Let's see.
You can't even focus anymore because of that pizza. I can tell you're just derailed right now for Dom. Dude, I wish I had a hot pie from Domino's right now. Are you
waiting
kidding
for
me?
You? I mean, is there? Where's the closest Domino's to you? You live kind of in the woods in the middle of nowhere.
I'm out a little ways, but there's a Domino's right just down the street. The problem is my wife's gluten-free. That's the real problem. So.
Oh, is she really? I didn't know that.
Yeah. Gluten's the enemy now. So.
Man.
Yeah, there's a lot of gluten with pizza. So there's gluten-free. I understand there's gluten-free crust out there, you guys.
Well, my wife is lactose intolerant, so that's
Yeah.
Tomato.
You understand.
Let's see. Actually, that's the only question I see. I thought I saw others, but I guess they were just comments. Guys, if you have questions, throw them in the chat. We'll make sure that we get them answered. So, to me, I think another thing that's probably an important thing to be discussed this AEP, and I think I'm almost down to about halfway, so I probably need to call it quits.
Just slam it. Just slam it. Come on.
Just go on. Go on. Hey, I'm north of 30 now.
Oof.
So
sounds old, doesn't it?
I was hanging out with Josh Lustig and Justin Thomas, who are both in their 20s, and they wanted me to stay out till like 3 a.m. And I was
they're
like,
really both in their 20s still?
They are.
Jeez. Wow.
And I was like, you guys, I'm over 30. I'm dirty 30. You guys can't relate.
Dirty.
Like, like you guys just don't know what I'm dealing with right now. Like it's 1:30 in the morning and I'm dying. I want to go to sleep.
Oh my gosh.
No, but anyway, I think a big thing that is going to be another topic of conversation this AEP is I talked about it a little bit earlier, but my viewpoint in a lot of markets is the carriers are making more changes than they have the last couple of years. And a lot of them are not making positive changes in some areas. They're pulling their benefits back a little bit. Why? Well, because CMS has cut some of the funding for Medicare Advantage plans going into next year. So the funding is a little bit less than it has been in years past. So as a domino effect, these carriers are kind of raising copays. They are finding ways to cut benefits. And we're seeing that a lot more than I think people are talking about. And what happens when people are used to getting their benefits increased or used to their plan staying the same, and then all of a sudden the plan retracts a little bit? Well, they might want to shop because they feel like, oh, there must be something better, because they're used to increases. They're spoiled. They're used to more instead of less.
Right.
I think we're seeing a lot of that. I've seen that in a lot of different markets as I've, kind of done the landscape scope over the last 30 days or so.
I'm also interested in what the percentage. So something at Lead Heroes, you guys, that we track pretty closely is every year after AEP, we're looking at every county across the U.S. Again, this is CMS data that they provide, is the Medicare Advantage penetration rate per county. So it's usually pretty easy to see the slow kind of shift more towards Medicare Advantage. So I am curious to see what the impact is this AEP compared to other AEPs. I feel like it's usually like a 1% to 2% shift every year. So it's like year by year, it doesn't seem like a lot, but then all of a sudden over the course of a decade, you're 15% deep into Medicare Advantage out of Medicare Supplement. So that's something that I'm definitely going to be watching, and I'm very curious about is, what sort of plan rate changes are we going to be seeing in some of these areas? Because it does seem like Medicare Advantage has grown network-wise and plan-wise, carrier-wise. It's more popular and more stable than ever. So I am curious to see what that's going to look like post AEP January 2024.
This is a question we need to answer. And I have an opinion, but I'm interested to know what you think and also what all of the people watching think. Comment your thoughts after I ask the question, okay? Just like flood the comments.
Flood the comments. Flood them. Send the flood.
Flood them.
Flood them.
Do you think CMS has a vested interest to do away with MedSup?
Say it again for the people in the back.
Do you think that CMS, the Centers for Medicare and Medicaid Services, have a vested interest in doing away with MedSup?
While we're waiting for the flood to come in, and if you're on Team Replay, you guys, we still want the flood on this question.
Comment #Team Replay.
Yeah, Team Replay. We still want to hear from you. Flood the comments. I do think that they have this vested interest because you're essentially shifting from it's more of a private burden, right? You're shifting the cost, and the carrier is really more so taking on that cost versus the government having to take on that cost. So I think financially there is a vested interest for the government to put more people on Medicare Advantage. But it's a collaborative effort though, because the carriers want it. And if they're able to keep the people in network with the doctors, then it's cheaper across the board. So from a profitability standpoint, you said earlier when you were talking about how, again, shout out to Galen Hendricks, how they were just getting absolutely punched below the belt, losing money hand over fist with MedSup.
Yeah.
Medicare Advantage, I think, has the ability to be more profitable on the carrier's end and on the government's end. Because if they can keep it in network, they can pay that doctor less, whatever services are nearby. I think the way the whole thing backs out, it's more profitable for everybody. And that's why we've seen the growth, and that's why it's become more and more and more popular. But the problem is they can't kill Med Sup. They can't just load the gun and like they can't murder Med Sup overnight. It's going to be a long, slow, torturous death of Med Sup. And I honestly would argue they probably can't ever kill it because there's reasons that it's needed. I'll give you guys an example where I'm at. Christian mentioned I'm kind of out in the boonies. Again, it's Western Oregon. So literally there is no network. I even had Christian one time, we were talking on the phone. I said, here's my zip code, pull it up. And he's like, whoa, there is no Medicare Advantage plans where you live. I said, I know.
There was nothing. I was ready to send him some contracts.
He's ready to write me a Medicare Advantage policy. I said, Christian, I'm 33, dude. You can't put me on a MAPD plan quite yet. I mean, maybe he just closes, guys. So that being said, that's my long-winded answer.
We do team true up. We don't do anything else around here.
I want to hear it from you, though, in regards to that same question. Does CMS have a vested interest in pushing Medicare Advantage over MedSup?
I think they definitely do. I think that CMS is not good at being an insurance company. I think CMS is wasteful, stupid, incompetent, inefficient. And I think insurance companies are the opposite of all those things.
Yes.
I think insurance companies are smart, calculated, efficient. They're everything that CMS is not. And so I think it's so much easier for CMS to just hand the reins over to a carrier and let them administer care for a senior. Because insurance companies do what they do, you brought up the point with the networks, which is a huge point. It's also because they don't approve things without, the proper pre-authorizations, the medical,
right,
all those things. Some people hate on that, and certainly there's situations where carriers are a little too strict about it. But overall, it just makes sure that things are being approved for medically necessary things. Medicare gets taken advantage of by fraud a lot more than carriers do because Medicare approves everything. They don't review anything. They don't check anything, right? They're just like, oh, you want to be approved for plastic surgery? All right, you're good. Yeah, I mean that's an exaggeration. Obviously, Medicare wouldn't do that, but
well, let me interject here though. So we're talking about Medicare Advantage networks, how it's more efficient. Are we going to see insurance carriers like Kaiser and Providence and some of these other bigger carriers where they're trying? Not only are they trying to be in network, they're trying to do the whole thing A to Z. It's a Kaiser pharmacy. It's a Kaiser hospital. Your primary care is a Kaiser doctor. The building's owned by Kaiser. The doctor works for Kaiser. Your insurance premium is Kaiser. Is that the future? Speculate for me, please.
I'd hate for the compliance police to just go posting that I speculate more, but the 5 app a year written compliance police. No, I think that you're going to see a lot of more carriers do that. There's carriers that are more under the radar that people aren't even thinking about that are doing that are trying to do that too. Think about. I don't want to get in trouble, but I'm gonna blame this. I'm gonna blame this.
Okay.
CVS buying Aetna, right? So CVS is going to control the pharmacies. They're opening up clinics and doctor clinics and urgent cares within several CMS locations around the country. That's something they've been planning for a long time. I bought stock in CVS about 4 or 5 years ago, and they were talking about that on earners calls and shareholder calls 4 or 5 years ago. They're talking about those doctor clinics. And, we're just now starting to see it really kind of transpire. Plus, they own the insurance and they incentivize people to get their prescriptions filled. And, within those organizations, you look at, I'm terrified to say their names. I'm not going to, but the biggest insurance company that does Medicare, if that gives any hints. They're very together.
No, I don't want to see any comments which carrier he's referencing, you guys. Keep the comments clean on this one.
I said this in a seminar the other night I was hosting. I said, Together Healthcare.
Together.
They're very together.
I love that. I love that.
So they have subsidiary companies that are buying clinics all over the country. Like in our area, I know about 5 or 6 different clinics that have got bought up by them and turned into their subsidiary. Right. And so I think it's happening a lot more under the radar than people realize, where they control all of the means of distribution. They control all of the means of care from, you said it best, A to Z. In my area, there's a very large regional carrier that is owned by the biggest hospital system in Utah. And they've been a force for a very long time in the Medicare market and the ACA market, even more so. And so, it's one of those things that I think a lot of carriers are trying to play the Kaiser game. They're trying to build with the Kaiser model. They're like
vertical integration, right?
Yes.
Vertical integration.
Yes. Yeah. Vertical integration. And, I'm working on a book right now about multiple streams of income. It's what I call the tree of life. The tree of life, you guys. So should I go off into this? I don't even know. I guess I have to now.
Yeah, you have to.
The tree of life, guys. If you want to build multiple streams of income, the way to do it is to build a solid tree of life. The tree of life is your primary source of income. And then once you have this primary source of income built, and it's substantial and it's cash flowing and it's killing it, you build branches that are related to your primary source of income. Right. So like if I'm a Kaiser, what was Kaiser's first business? Hospitals, right? So
I'm pretty sure it was hospitals. So
they build the tree of life. The tree of life is hospitals. What happens next? They build out insurance products that only let you go to their hospitals.
Right.
It's a branch, right? But it's all supported from the tree of life. It cannot exist without the tree of life.
There's a comment here that says, you need another drink.
It's going to be a good book. I promise. I promise it's going to be a good book.
I think that makes all the sense in the world. Again, it goes back to the ancillary conversation. I think having an ancillary or two that you like, that you can pivot to, is a no-brainer. You're already talking to the Medicare beneficiary. You already have a needs analysis done. You have their information. You already know what would be a good fit for them. Why would you not offer them something that would fit? And again, another branch, another revenue stream. I think it's a no-brainer. I really do. I'm a little nervous because I think in the sense of the conspiracy conversation of agents being cut out completely, I think a completely vertically integrated insurance carrier probably needs an agent less than an insurance carrier that's not vertically integrated. I mean, Kaiser, for the longest time, you couldn't even sell it.
And you still can't in their biggest, most important
market. Right. It was a big deal when they started letting some agents get in on that. So I think it's a good thing, but it's also potentially dangerous to an agent. So some answers, you guys, from the question that we asked you to flood the comments with: does CMS have a vested interest in killing off MedSup and moving more seniors towards Medicare Advantage? It's a government program. Of course, it's not ran efficiently. I think that's when you're talking about how insurance carriers are. Yeah, you're right. It's the complete opposite. They are literally designed for efficiency. I'm just waiting on each of the carriers to offer cancer, hip, with MAPD. Yeah, I mean, some carriers do that, right? Some carriers are offering those ancillary products right there with the Medicare app,
I heard a whisper several years ago that Medicare Advantage plans might even start offering long-term care. I mean, you don't know that hasn't happened yet, but it's something that, let's say 3 years go by, another election happens, we get a new CMS commissioner. The CMS commissioner is like, more funding, bro, more funding, pull back regulations. If you get a scope of appointment, you are fined. They go the complete opposite. They pivot, right? You might see some of those additional ancillary benefits start to add on, right, to just as included in the Medicare Advantage enrollment. Things can change in a split second. It seemed like just a short couple of years ago, it was, compliance. There was very little compliance to speak of. There was no 48-hour rule. There's no call recording rule. All of that escalated very quickly with adding the rules. If you really look at it, it's basically a 12-month period, 12 to maybe 16-month period. And so I think that's something that agents need to be aware of is like, another election happens and there's a new CMS commissioner, because the CMS commissioner is appointed by the president. You don't really know that.
Right. It can change fast.
In a second.
Yeah, it can change fast. I think that's a really valid point. I've got a question for you. Toppings on the pizza. What was the decision when the Domino's got ordered? What toppings were on the pizza? Pepperoni? Is it meat lovers?
Well,
I kind of feel like you're a meat lovers
guy. I had no decision. I had no part in the decision of the pizza. I didn't even know it was being ordered until she was opening the door and there was pizza. I was like, oh, there's pizza.
Okay.
I would imagine, just based on history, that there's half pepperoni for me because I don't like anything else.
You're like my 8-year-old daughter. That's adorable, dude. That's adorable. and now your wife, the adult in the room, what's on her half?
She probably has mushrooms, peppers. She probably has all different kinds of vegetables, and I'm just like, give me pepperoni.
Gosh. Your poor wife having to put up with your 8-year-old palate.
Somebody said either way it's cold now.
Yeah, either way it's cold now.
Sitting over there on the counter.
I feel guilty, you guys. Christian's gone 30 minutes past that pizza sitting there now. I want to be respectful of his time. It's also getting late. I appreciate everybody who's tuned in to this late night Friday night emergency podcast. AEP is here. If you're watching the replay, again, comment #replay. Answer some of the questions or drop a new question.
Yes.
And we'll get back to you another time. It's only 10. It's only 10 if you're Pacific Standard. Mr. Brindle is actually on Mountain Time. So it's actually already 11 o'clock for him and East Coast. Good Lord, if it's 1 a.m. and we've got anybody on the East Coast actually watching this.
Real quickly, awesome. Just to close it out, instead of doing final thoughts, why don't we mention what we're doing tomorrow instead of final thoughts? Like what is our plans for tomorrow with our final pre-AEP weekend?
I like it. You go first.
So I am going to clean a bunch of my pistols tomorrow morning. I've already set time aside for it. Everything goes in the calendar. And then we have a babysitter coming. We're going to go shoot those pistols and dirty them again.
Did not expect this at all, by the way. When you were talking about what you're doing tomorrow. Okay, keep going.
I bought a new gun on my birthday. I haven't shot it once.
Yeah. I remember you telling me that.
I still have the AK-47. We're not going to shoot that. We're going to shoot the pistols. And then we're going to...
Why not the AK, dude? I remember when I
don't have ammo. I can't find it anywhere.
Dude, that's one of my favorite guns I've ever shot was an AK.
I can't find it. I can't find the ammo anywhere. I've gone to 3 different stores now, and they're like, And they're like, yeah, we have like a box this big of ammo, and that's it, like in the whole store. I'm like, well, give it to me, but I'm like, I don't have any ammo, so I need to order online and get some ammo. But we have like a lifetime supply of pistol ammo, so we're good there. We have like 4 pistols we're gonna be taking, and then we're going to go to the movie theater and watch the Canelo fight.
Whoa!
They're playing it at the movie theater.
Really?
Yeah.
That's super cool.
So I'm kind of excited.
Do they do that with all the fights?
I've never seen them do it before. It might have just been that I didn't notice, but I noticed this time.
I think there is a future for, because again, it seems like people are going to the movies less ever since the pandemic. I think that's a really cool idea for movie theaters in the future, is like major sporting events, major fights, maybe like old school movies that have been out of the theater for 10, 20, 30 years. I think it's really cool when they do stuff like that. Well, it sounds like you're celebrating America tomorrow. That's what I'm hearing.
There's a chance we might not go to the Canelo fight. My wife's not super on board with it, so we might just go to dinner instead. We'll see. But
well, now you're bumming me out.
I'm pushing for the Canelo fight. I'm trying.
That would be awesome.
I'm excited about it. Like, you spend 4 hours in the movie theater. It's like luxury seats. They bring you food. Like they come take your order and stuff. It's like everything. It's everything I've ever wanted. And see Canelo knock some fool out.
Everything I've ever wanted. I love that. I have nothing nearly as exciting as your day planned for tomorrow. My daughter has a soccer game. My 8-year-old daughter that I mentioned, she is playing soccer. Yes. It's her first year. She's loving it. So I have that in the morning. And the plan is kind of to, again, since the chaos is coming, anything that is, like you mentioned, cleaning the house, like that'll definitely happen. Another thing that I've got going on is one of my cars has a bad battery. I bought a new battery for it, but I haven't taken the time to put the battery in the car. That's the sort of stuff that like I want to knock out this weekend. So that way, like by Monday next week, I don't have to, worry or think about that stuff. So probably going to be putting a battery in.
Can I confess something to you before you go on?
Yeah.
If my life depended on it, I couldn't figure out how to change that battery.
Really? Dude, that's easy. It's so easy. Now, mind you, like if you were said, hey, Glenn, you need to change the oil on that car, I probably couldn't do it. I've never changed my own oil before, but
I did it one time and it spilled all over me.
Yeah, that doesn't surprise me.
And then I was like Jiffy Lube for the rest of my life, $20.
The cost has just never made sense in my mind. It's so inexpensive. Why would I do it myself? Some people I know enjoy doing it, but dude, batteries are so simple. Just take off the connectors, put the connectors on the new battery, dude. It's super, super. I guarantee you, in a pinch, you could do it. If your life depended on it, it's like, Christian, replace the battery or your family's gonna die. Like you're gonna tell me you couldn't replace the battery in your vehicle, dude. You could. I promise.
They might die. They might die. It might be the end.
Oh my gosh. All right, you guys. I think we have come to a conclusion. Christian needs to get his pizza. I think this should really end. We need to visually see a slice. Can you go grab a slice? You said It's on the counter. Can you grab a slice so we can see it? Don't do it, Christian, someone says. Thanks, you guys. Right here in Florida, Ramiro, hey, MVP, 1 a.m., past 1 a.m. now, and you're tuning into the live stream.
Man, that inspires me. That makes me want to stay up myself.
Yeah, seriously. There it is, you guys. There it is. Give us a taste. Yeah, let us. Can we get let's get a quick review here. Preset appointments. Yes. Lots of preset appointments coming. Okay, yes. Is it cold? Is it cold pizza? No.
It's actually perfect.
It was too hot when it got there.
If I ate it when it first got here, I probably would have burned my mouth.
Dude, I burn my mouth on hot pizza all the time. That's a bad one.
Me too. It's a problem because I want it so bad I can't wait, and I just go through the pain. I burn it the entire time.
Shows your age being able to eat pizza this late. He's old. Hey, let him enjoy this. He has very little time left of slamming a pizza at 11 o'clock at night. I'm not. Someone just ordered a pizza. You inspired someone to order a pizza. You need an affiliate commission, Christian, on that. You should be getting a payment.
I'm the master of affiliate commissions in the insurance space. We'll figure out a way to do it.
I said this episode was sponsored by Domino's, and boom, a pizza got ordered. Someone said preset appointments. You guys, if you have questions about preset appointments, if you placed an order for preset appointments, please shoot an email. I've gotten tons of messages this week and today specifically. Please shoot an email over to leads, L-E-A-D-S, leads@leadheroes.com. We will get back to you as quickly as possible. We won't have anybody in the office for the next 2 days, but Monday morning, we will get back to you right away.
This comment from Frederick, I'm loving this. I just found a theater in California that is playing the Canelo.
Wow, look at you. Look at you, dude. You're a hero. You're a hero. Another affiliate.
This video is sponsored by Lead Heroes, you guys. Every video is sponsored by Lead Heroes.
Yeah. You spelled it wrong. Again, I'm not sure who that. It's leads, L-E-A-D-S, at Lead Hero. So it's singular lead, L-E-A-D, and then heroes is plural, H-E-R-O-E-S. There's an E. When I put that together, I never thought there would be as much confusion around leads at leadheroes.com, but I'll drop that in the comments just to make sure you guys have that if you have any questions or concerns about presets. But I think that's it, you guys. Have a wonderful AEP. And yes, there you go. You nailed it. You got it. Yeah.
Hope you guys have a great AEP. Hope it's incredibly prosperous. And yeah, guys, now's the time to make hay. So make the most of it. And
absolutely. It's a gold rush.
Don't get too overwhelmed, guys. We will see you guys soon. I'm sure we'll do another emergency podcast before the finish line. I'd be shocked if we didn't. So we'll see you guys next time. Have a good weekend and later.
Eat more pizza.